knee pain. I think for the most part, all of us have probably experienced some sort of knee pain, knee discomfort, something to do with our knees. And it can go from some sort of impact injury, as simple as like you like losing your balance and fucking falling onto your knee, to a point where you walk a corner too fast and hit the coffee table really fucking hard and you end up falling over and, being super exaggerating of how terrible that was, to a sport getting cut by the side and tearing something, or simply you start running and your knees start fucking hurting for some reason. So we're going to kind of go over the things that I see, at least in a clinical setting and also from a training setting, and what I do about it. To kind of begin, we're going to start off with anatomy, of course, because that's what you do. All right, well, this image is kind of small, but I'm going to do my best. It's always better in video. Which reminds me, if you guys have not subscribed to my YouTube channel, what are you waiting for? Well, this is our knee joint from the front view, from the side view, and from the back. So the big bony thing in front of you is part of the knee joint, and it kind of just floats on top, because like if you have your leg extended, but not like to a point where you're extending where you're activating like your quad muscles, you can actually move your tibia back and forth for just to see if you actually have movement. And a lot of times when people have a stiff patella, then that kind of leads to not the greatest sensations in your knees when you start running or doing any kind of single leg work, or even when it comes to, you just had an ACL surgery or any kind of surgery around your knee and your patella is not tracking the way it should, then it could just be like some scar tissue stuff and you need to work that out. But there should be some movement with the patella, kind of floats on top, and it's supported by a lot of like tendinous and ligamental structures to keep it where it is. And then you have your shin bone called your tibia. So if you imagine, if I can get my knee up here, so my patella right dead center, and then my tibia, this big bony thing, is right here. And then we have something called your fibula, which is actually not in here, but it's this guy right here, pointing with my little mouse cruiser there. And it's the little bony part on the outside of your knee. And the reason why this is all important is that when you walk, squat, your tibia can actually move back and forth. And you can kind of see, I'm literally just doing internal and external rotation of my tibia. The little paper clip that I have up here put together represents where my tibia is. So right now it's pointing towards you. And if I think of rotating it to the right, and yes, your knee joint can rotate, it doesn't just, extend and flex. So look at the origin of where my knee is or my tibia is. And now look at where it's pointing, out this way. And now I'm back to the center, out to the side, back to the center. So why is that important? Well, when you decide to squat, that tibia needs to be able to move. When you decide to run, that tibia needs to move. When you decide to do a lunge, that tibia needs to be able to move. When you deadlift, that tibia fucking moves. What happens when your tibia doesn't have that range of motion? Knee pain, ankle pain, hip pain. One of those three things can happen. And a lot of times when people say like, oh, my freaking knee hurts, I don't know why, like I'm foam rolling every single day, I'm doing mobility, whatever that means. I do this with everyone. I check tibial rotation because they don't have it, and they're telling me they're going to the gym 3, 4, 5 days a week, or they're deadlifting and squatting all the time and their numbers are not going up. And I'm like, well, yeah, you're physically fighting your own like anatomy and biomechanics of how far you can take your body. And this is something people don't ever think about when they exercise. And all of us who go down this whole realm of like health and fitness, I want to lose weight, I'm going to start running, I'm going to start doing leg day because that's what Instagram is telling me to do. But you're limited to what your knee joint itself can do, right? So this is important why you need to know anatomy. This is why it's really important to exercise selection and how to stay pain free, because we all know, and I've brought this up on my show so many times, that in order for us to be successful, we need to have consistency, right? We need to have a certain amount of workouts every week. We need to have enough calories burned, but you can't do those things if you're constantly dealing with knee pain. And it can be something as simple as like just getting more range of motion of your tibia. Like, it's not rocket science. So now the question becomes, well, how do I get more range? And when you look at, like, say, the definition or a description of what a joint is, we all know that joints are designed to move. So then the next question becomes, when was the last time you moved your tibia? And most people look at me like, what the fuck are you talking about? Right. And, again, I'm biased, Kinstretch instructor, huge fan of Dr. Andrew Espina's work, but it makes sense to me. Like, if you don't use a joint the way it's designed, then you're not gonna like maintain its function. If I take my elbow and keep it like this every day for the next fucking year, it's probably not gonna be that great to extend it to where it's supposed to go, right? So same thing goes with your knee. If you don't practice what it's capable of, it's never going to give you those options. And sure in hell won't give you the option to do so when it comes to a squat, like a back squat, where you fucking have a barbell loaded onto your spine and you're just hoping for the best when you're trying to do 195 pounds. So let's get into some exercises, which I've done before for this one specifically, but we're going to go over knee cars. All right. So I've brought this up before. So we're literally doing the thing that I did showed you earlier with my own leg, and we're just going from external to internal rotation, right? And you can literally see, like, actually this guy right here, fibular head, but we were looking at before as I changed my side. But yeah, we're just going back and forth. And the key thing here is, like, look at the angle of my ankle. If I had my foot out straight, then I wouldn't really get that much rotation. And I don't know why I pressed play, but yeah, I wouldn't be able to get enough rotation having my foot in plantar flexion. That's why I need to make sure the ankle is locked out. So then you can move primarily just through the tibia. That's one option. Going back to my previous statement of, if I don't use my joint the way it's designed and I limit, it to, in this case, being in a flex position, knowing that my knee can also extend, then I'm leaving a lot on the table. So what you do is also practice knee cars with extension and flexion. So I'm going to flexion, going back up to extension, and I'm doing tibial rotation in that extended position because your knee can do that, which again should be part of normal knee function. So something like this is, for me, I do every single day as part of, like, my warm up routine, or even before my Kinstretch, or if I'm back squatting or doing lunges that day in my workout, then I'm going to do this as my warm up, right? So there's ways to also isolate that motion. And a couple, all right, so I have a yoga block in between my knee. And now you can see that I'm going back and forth between external and internal rotation. And it's something that, most people can do. It's a different position you're standing rather than seated, something to play around with. But if I had someone with a really, really sticky tibia that does not move, then we need to do some pails and rails. So I have done a lot of content on pails and rails, so I'm not going to go over that in depth. It's important to note that pails and rails is the magic sauce when it comes to creating tissue change. So I literally have put my tibia in a externally rotated position and I have a full stretch. So in this sense, and this can be a little bit aggressive for most people, like, it's a yoga block, it's quite big. So you might want to start with something smaller. And I'm literally just holding that for about 2 minutes. After the 2 minutes, we're going to start doing our pails and rails contractions, where we're force feeding our nervous system at a cellular level to influence the tissue for change. So now I'm pushing my foot down into this block as hard as I can to affect all the tissue at the top here of my shin. After that, I'm going to do the opposite, where I'm going to try to drive the toe off it, which is going to be impossible because I'm at my end range. But now I'm creating an isometric contraction on the other side of my tibia and all the tissue underneath. So now I have some tools in my toolbox to create a better moving knee joint, essentially. But the other thing that people don't think about a lot, and this happens a lot in the clinic, people come in with knee pain and they're like, I need your help. I need you to treat the knee. But then our practitioners, and myself included, when we assess the person, I would say 9.9 times out of 10, when it comes to knee pain, you check their hips and their hip mobility is terrible. So let's look at front of the leg here. The big thing is look at all this white stuff. At a certain point, all these muscles that run from the hip coming down blend in with each other. For those who've done a cadaver lab or have seen cadaver dissections, if you were to have this section in front of you getting really close to the knee, it's going to be really, really difficult to figure out, which one is the IT band, which one is the rectus femoris, which one is the sartorius, which one is which, because they all blend in together. And this is the whole concept of bioflow when it comes to movement and how everything is literally integrated with each other. Yes, there are separate muscles, but they all intertwine with each other at certain joints, especially from the hip to the knee, in my opinion. A couple things that I always see is people will get, say, pain in the front of their knee, right? But again, look at all this stuff that blends into this one area. There's a lot. So if somebody has a tight hip and they have these muscles that run all the way down to the knee, then the line of pull from here to here is going to start tightening up. So sure as shit, your knee is not going to feel good if all this stuff is constantly tight, aka you sitting every single day and being inactive, right? The other thing too is people will start running and their IT band gets super tight. And again, the IT band is designed to be tight, but for most part, we all sit, we already have tight hips, tight quads, and now you start running where literally the motion of running, every time you do a stride and your foot goes down to the ground, all of your quad muscles are designed to prevent your knee from hyperextending and popping out of place. So every foot contact with your body weight of, say, anywhere from 150 to 250 pounds needs to be stopped multiple times. Like in a mile, the amount of foot contacts per leg is around 1,500. Like, holy shit, that's a lot of work for all these muscles to prevent your knee from doing that, right? So you're taking this individual or yourself with a really, really, really tight hip and tight quads, and now you're adding this. Sure, yeah, your IT band's going to get overworked and stay even tighter because it's trying to do its job. But now you're just kind of fueling the fire with more gasoline on it, and you got knee pain. But now imagine you have this other muscle, which is super important in my opinion, called your sartorius. It starts from the hip and works its way down all the way to the inside of the knee, wraps around to the front. If you're telling me that your hip has no influence on how this knee feels, so for me, when I do kin stretch, what's really interesting is seeing how people's bodies have adapted. And when I do any adductor work, because the sartorius is an adductor and a hip flexor. So when I do those two motions with people's hips, they're really weak, really, really weak. And what happens in our body is when something is weak, something else has to make up for it. And usually we'll make something else tight to compensate for it. So we have all these things that are working against us, and we're surprised when our knee starts hurting, right? Like I am literally just scratching the surface on all of this stuff because I can talk forever on hip mobility, knee pain, knee motion, things like that. So, to kind of make it simple, if this hip does not move, then the motion that is necessary for you back squatting or running or walking is going to have to be made up from either the knee and worse yet, the fucking lower back, which is another joint that's not meant to have so much range of motion. It's meant to be stable, right? So that's how our body works is if one segment or one area doesn't move the way it should, the thing above or below it is going to have to do more work. Now, the other thing, and I don't have a photo of this, remember how we were looking at the knee, the tibia, which is right here. Now, remember how it's supposed to rotate? What if this joint here, your ankle, doesn't move as well as it should? Now, if you think when you squat and you're descending down, your tibia doesn't stay upright like this. It has to go forward into an angle where your knee almost goes in line with your toes. So what if this joint, like your talus, doesn't move and glide the way it should, and you get to a sort of sticking point, and that's as far as it can go? And where is the made up range of motion going to come from? Probably your knee, probably your hips. What if your hips also suck? And you're literally just jamming force into your knee joint. That shit's gonna hurt too over time, right? This is the other thing that people don't think about is like, do I have adequate ankle mobility? Maybe, maybe not. So we have that. The other thing I wanted to go over too is another photo of, we talked about the tibia, talked about the fibula, and the patella. But now in this knee, we have all these, you have your meniscus, all the cartilage, you have your ligament and everything else. So again, this can be another huge, huge, huge topic. One of the major injuries that I've seen is an ACL tear. And when people get surgery done, the number one thing they need to do is one, go through the whole, physio initial steps from the hospital that allows you to get discharged and go home and again start doing your rehab and physio, but regaining extension. So remember how I said how our quads are responsible to ensure that you don't go into hyper extension with your knee. But when you get an ACL surgery, it's really difficult to get extension back. And when you think about it, like we need to be able to extend our knee, and people will say like sometimes it just feels like locked or stuck and it can't move any further. So learning how to regain extension in a safe environment. And I'm not saying that you should do this on your own. This is where you need to hire a professional or someone like me who understands anatomy and movement to help regain that mobility. But a lot of times when people do their rehab and physio half-assed, they don't get that back. And then they have this weird feeling of instability in the knee and they feel like it's just going to pop out. And then the joke in my industry is like when you meet someone with an ACL tear, you ask them, when's the second time you tore your ACL? Because usually the people don't become, diligent with their rehab and movement prep when it comes to regaining range of motion in their knee. They kind of just like settle it because what do we do most of the time? What I'm doing right now, sitting, I'm having my knee in a position of like 90-degree of flexion and I'm not going to extend. Like, I don't know for you guys, like when I'm sitting watching a movie in the theater, like I can lean back and just extend my legs all the time because then my knees just like feel terrible if I don't extend them. But I think I'm going to leave it at that because we've talked a lot, or I did. Knee pain, huge contributors are your hip mobility and ankles. If you indirectly influence those two things, your knees are going to feel better. The analogy I give all the time to clients and patients is imagine if, you're looking at my ceiling right here and you see this huge like stain, you're like Okay, that's water. Would you, as a homeowner, you wouldn't be like, oh, well, I'm just gonna patch that up and it's gonna be good. Because we all know that a month from now, you're gonna see the same thing and it's gonna get worse. So when we see that there's that circle of water damage, we right away know, okay, well, above that ceiling, there's something that is causing that leak. So we're gonna have to open up the ceiling and fix it and then repatch the ceiling. Our bodies are the same thing. If my knee hurts, I'm not going to just go treat the knee because most likely the thing above it is causing the pain. So, my goal, I guess, with this episode is not only is it to help educate about knee pain, but to go seek out individuals and professionals like myself that have experience to help you through it. Because a lot of times it's not just I'm just gonna, rock tape or put a brace on my knee and foam roll the shit out of my IT band. It's other things that you need to be more proactive with and choosing exercises that you may not be able to do just yet that will help improve the amount of force being put down onto your knees. So I'm going to end it there. Hopefully that was helpful. Hopefully you enjoyed it. If you have any more questions about um, knee pain, hip pain, ankle pain, any joint really, feel free to reach out. Add me on Facebook, add me on Instagram, hit the show notes and watch this episode, and also subscribe to my channel. That is it for me, you guys. Until next time.